All right, we do have some brand new information coming in this morning from Jersey City.
The mayor expanding serious restrictions this morning, closing everything from gyms and beauty salons to daycare and dental cleanings. Mayor Steven Fulop talking to Pix 11 First this morning and joining us by the phone. So good morning to you, Mr. Mayor.
Hey, good morning.
A lot has changed since the last we spoke last week here, right? So you have a fourth case here in Jersey City. Explain the logic now behind the closing, pretty much shutting down the city.
Yeah, I mean, so we were the first actually in the country to put any restrictions on any sort of establishment. We did bars and restaurants and liquor license last week, and we see everybody else catching up. But we didn't absolutely close them because we thought that it would be hard on our businesses, our local economies in isolation. It wasn't like a regional approach. And now you see New York City doing that. Hoboken was extremely proactive. The mayor there was very, very good. And being that there's more of a regional approach, we think that the only thing that's going to work is social distancing. So we want to be aggressive in pushing people in this direction.
Seems like a lot of towns are doing the same with the social distancing, trying to flatten that curve. But at the same time, are you thinking about the economics of this? You alluded to it just a minute ago. But any kind of relief on the backside of this?
Yeah, I mean, the relief is going to have to come from the state ultimately. In New Jersey, local municipalities don't really have the tools to do that. But, yeah, we were very hesitant to do that despite people calling over the last couple of days to just shut restaurants and bars down. Absolutely. We were reluctant to do that because we didn't want to do it without a regional approach, because that would have been counterproductive to those businesses. So we're trying to be measured but proactive at the same time.
Is there a timeline here on how long these things will actually be shut down and how long you're telling people to stay inside?
No, I mean, we haven't put like kind of long-term timelines like some cities have done because we didn't want to box ourselves in, and we think being flexible and nimble is really important right now. Mm-hmm. So we're taking it week by week, and we'll assess the situation at the end of the week and decide what needs to change. So, there's no playbook for this, so we're all kind of learning on the job a little bit.
Let me ask you about the medical community. There's a lot of focus on that right now, saying that there aren't enough, rooms available in the ICU, not enough respirators, not enough supplies. How is your city handling this?
Yeah, so I mean, we're in constant contact with with our hospital system and urgent care facilities, and they seem to think that they're ready. I mean, I don't really know ultimately how you define ready. Nobody knows what that is, but they seem to think they are prepared and they have plans in place and they have tools and equipment there. I mean, we may tweak some of our executive orders that pertain to, I know you mentioned the dental offices and the physical therapy clinics and the non-urgent care, because we may not want to put restrictions on that. We're kind of working through that, but we started this morning with saying, hey, we're going to be aggressive on that. But going back to the hospitals, they seem to say they're ready, and that's what we got to trust.
Yeah, you announced this morning also, we're looking at your tweets on our screen right now, you also announced this morning a fourth case in Jersey City. Last we spoke, we talked about testing, right? And the fact that many people were calling that hotline saying, hey, I don't know how to get tested. Where are we with tests? Are there enough? And how do people go about saying, okay, I have symptoms and I want to get tested?
Well, no, there's not enough, and they're not coming quick enough. That's the honest answer, and that's, again, a federal issue and state issue with regards to guidelines. So you have to have all of the symptoms in order to qualify for a test. So you obviously have to have respiratory issues, you have to have a certain fever, you have to have coughing and sore throat. And all of those things combined, you could then start to qualify for a test, and it takes a little bit of time. If you call up and just say, I have a fever or a sore throat in isolation, they will not test you. And that's not Jersey City protocols, that's state and federal guidelines. So once they loosen that up, we're going to be able to get much more people tested and more awareness of how widespread this is.
And how closely are you working now with the governor's office? We're hearing from the health experts right now and the health people, nurses and doctors, that there are not enough supplies like Betty alluded to. So are you talking to the governor about that, and when can that relief be expected for them if there is, God forbid, an influx in patients?
I mean, we are talking to them. They said last Friday that they would loosen guidelines, the state guidelines on testing, and then that would allow us to expand testing pretty significantly. So we're still waiting on that. But, they're working through this as well as quickly as possible. I mean, it's a very densely populated state and very complicated, so it's not easy to manage, and I think they're doing their best.
Mayor Fulop, I appreciate your time this morning and this new reality of talking by phone rather than having you here in the studio. Obviously, we're doing our part in social distancing. Thank you for making your point available and your voice heard. I think it's very important.
Hey, thank you, guys.
All right,
thank you. Bye.
Take